My name is Peter Waiganjo. I work as a venture development manager with AMREF Health Africa in Kenya. Sustainability is my story, private sector is my story. Project brief. So AMREF is, and correct me if I get those acronyms wrong, we are PR2 on, on HIV, on TB and malaria. So I will present the statistics as they are for 2021 for TB and malaria. So I'll be speaking between the two. So we are PR2, the grant number is there. We work in all the 47 counties. The good thing about this, we do not work alone. We give this money to communities, community-based organizations and other CSOs to implement on our behalf. We have a total of 33, 24 which are community, 4 that are KIC TB. So the engagement process is still ongoing for additional 3, 2 PPM and 1 community-based. The period of the grant is between 2021, July, to 30th June of 2024. The total grant for TB is $107,961,377 million. It is categorized into 2. 1, the new funding mechanism. 3, grant is total is 53 million or thereabout. The COVID-19 resource mobilization is about 54 million. So we've already done the first part, which is the fast track of 12 million to support the government in supplying oxygen to about 332 health facilities in Kenya. Next. Yes, malaria grant, quite small, PR number 2, that's a number. The total funding running through the same period of time is 23,224,000. And that's inclusive as well of about 6 million to support the COVID-19 mechanism, response mechanism. Next. I thought it's important to mention this because these are the people we work with, and these are the people we support in helping us implement. So we just did the selection of the sub recipients, and these are organizations that are either based in those facilities. So the process is simple. We do a desk review. We open the tender for the 8 counties. Number 3, there's a selection part, and then there's the onboarding part. For malaria grant, we had 11 SRs who underwent the review, and 8 of them were already engaged. I'm not sure whether they sit in KHF. Daktari.
Some do, yes. Some
okay,
do.
Good.
Yeah, actually majority.
Yeah. Next. So in terms of implementation updates, I will not go to the nitty-gritty of the numbers, and I'll just give you the finance updates. So I thought this is a very important slide because then we're dealing with the private sector, and there's a private sector angle for the Global Fund grant. And therefore the PPM mix. So the mapping has been done in all the 47 counties, and the 47 counties have been categorized into two. Category A, 20 counties where we have high burden of TB and account for approximately 80% of the TB cases from private sector with high burden population. And then we have 2 SRs, which is RESOC and NEFAC, covering those number of counties. Category B, we have 28 counties. I'm not sure why there are 48 counties, but the total is 47, so which have low burden of disease. And then we have 21 SRs doing that. So the second column is progress update in terms of the selection, and I had mentioned about that. Next step is finalization of the contractual process with Category A SRs to begin the implementation process. Next. Financial update, the exciting part. Yes, the absorptions and so the PR, those are, so in terms of AMREF TB, the budget was about 13 million. We are at 29% absorption rate based on the cumulative expenditure. And that is what has been earmarked. For malaria, against a budget of 3 million, we've spent about 1.3, which represents 44% performance or absorption. Next. For COVID-19 response mechanism, for the activities earmarked under the TB grant, We had earmarked a budget of about 3.34. What has been expended is about 6.9, but we have obligations of 6.9. However, our performance is 22%. And we'll come to the reasons why that is happening. Under HIV malaria, we had a near-marked budget in 2021 of 1.13. Our obligations, our absorption is 261. We have obligations about 712, representing a 23% performance. Next. Here are the reasons and the challenges why we are doing dismally. First of all, on oxygen, which represents, it was a fast track and we needed to support health facilities and the government in making sure that we are able to manage the COVID-19 waves that were there. So number one, we had supply of oxygen to the counties comprised of 76% of the total CR19 RM budget. There was a delay, or there is a delay spending this budget due to one, inadequate cylinders from BOC. I think by the time we were doing the procurement, the total cylinders in circulation in this country are about 22,000, which cannot, total in this country, so that cannot match the supply and the waves that we had. And then we have slow rate of ordering from counties due to reduced demand, the up and down, the waves and all that. Counties receive bulk oxygen, do not have oxygen tanks, so those are some of the activities that we have to do. So we have awarded the tender, but no one is consuming the oxygen, the cryogenic oxygen, which is in tanks. Tender for procurement of cylinders was not responsive. However, that is now ongoing, I can confirm, but it should come through. Mitigation, that has been done. We've had meetings with BOC, plus the oxygen tender committee, the oxygen committee, the National Oxygen Committee, and things are being addressed. Number two, delay in reimbursement of TB patients with malnutrition caused by challenges in streamlining the process of cash transfer using TB system. Solution, TB program has planned a meeting to upgrade the TB system. Meanwhile, the activity has resumed. Next. Part of the budget was for the activities to be implemented through the SRs who were engaged in September 2021. The response is that the PR is in the process. We are in the process of finalizing modalities of implementing the CRM19 activities. By the existing SR, the activities will begin in March 2022, which is the month we are. So I think a lot of progress has gone. Delay in implementation of RSSH activities that needed extensive consultation with various stakeholders to ensure inclusivity. Accelerated implementation began in January. And finally, delay in implementation of laboratory activities due to prolonged startup process, including development of specifications and discussions with the various stakeholders. These were necessary processes to be done and needed to be concluded before the implementation begins. So specifications for genomic sequencing equipment and reagents have been provided and procurement initiated in Wambo. Procurement of Gene Expert cartridges has commenced and is on course. I think that is my last slide. Thank you.